you're on metformin, these are certain things most doctors will forget to tell you, but you need to know this. First, what is metformin? Metformin is an oral medication that is one of the commonest medication prescribed worldwide for patients with diabetes and in some cases for patients with PCOS. It is very effective, it works well, and it has helped a lot of patients. But you need to know this common side effect. One of the commonest side effects that metformin have is GI side effects. So when you take this medication, it's quite harsh. So you might have nausea, vomiting, abdominal pain, in some cases, even diarrhea. These symptoms tend to get better after some weeks of starting this medication. So if it is mild and it's not distressing for you, just keep an eye on it. There are certain things you can do to help your symptoms. So what I tell most of my patients is this. Now, if you are having all this nausea, vomiting, abdominal pain, and diarrhea, what you can do to help yourself is to take this medication with food. So what I tell most of my patients is that when you want to take this medication, just start eating. Eat a little, take the medication, and complete your food. With this, many of them have come back to say it has helped. So you can also try that. The side effects I want to stress today are quite rare, but it's something that you need to know so that when you start having symptoms, you need to see your doctor, okay? So the first is B12 deficiency. B12 deficiency has been associated with the chronic use of metformin. So once you start having B12 deficiency, there are certain symptoms that you start presenting with. One is fatigue, malaise. You just have this feeling of tiredness every time. You can be having muscle ache. It can even affect your central nervous system. And one of the commonest symptoms that you have is pains and needle sensation on your hands or your feet. Once you start having these symptoms, all you need to do is to check your B12 level. And once it is low, there are medications your doctor will place you on and it will correct this B12 deficiency. The second side effect I need you to know is folic acid deficiency. Okay? The chronic use of metformin has been shown to cause folic acid deficiency. And as a pregnant lady, you need folic acid in high amount because of your child. So if you've started metformin and you are having fatigue, tiredness, anemia, you are looking pale, you could be dealing with folic acid deficiency. So all you need to do is to do a folic acid level, and if your folic acid is down, we'll just prescribe oral medication for folic acid, and that sorts out the problem. The third and last side effect I will talk about is lactic acidosis. This is very dangerous. If you have anyone taking metformin, please share this video to them. If you are taking metformin and you are having any side effect from the metformin, please put it in the comment section so that others will learn. And if you have questions as regards metformin, put it in the comment section and I will respond to your message.